So there's a number of us who keep looking at different ideas and different numbers. And we keep trying to say, okay, what would happen if we actually took all the outlays and rolled them back to 2019, before the pandemic? But some of the math, and forgive me, but we were like working on this as we're walking over here to the floor. You got a math problem. First off, the discretionary is shrunk from, let's see, it's $52 billion bigger in 22 than it was in 2019. So that's real money. But what has exploded are two things: the mandatory, Social Security, Medicare, all these other things that are formula, and interest. 2019, we spent basically $376 billion in interest. We're functionally heading towards doubling that in the coming budget cycle. So you got to decide. If I could adopt the 2019 budget, we would actually, with the really substantial increases we've had in tax receipts, tax revenues, tax collections, whatever you want to call it, if we adopted the full 2019 budget, we would be even. How many members of Congress are ready to get up here and we're going to cut Medicare, we're going to cut Social Security, we're going to cut veterans benefits, we're going to actually somehow pay less interest on our debt? And this is the point I'm trying to make, is the vast majority of what is government is autopilot. And what we actually debate, the theater around here. So in 2019, 50% of what we'll call discretionary, 50% was defense. The other 50% of that $1,330 billion or $33 billion, and half of it was true discretionary. I'm trying to make the point, if you're going to save us, it's got to be an actual discussion mostly about healthcare costs. I'm going to show you some boards here. And this is another one I bring back and forth. And I'm shocked how many, even my brothers and sisters who are actually hopefully watching parts of this, or their staff are watching parts of this on their televisions, a few hundred televisions around this campus, will digest. And for some of my brothers and sisters on the left, they actually get really upset with me on this. You can't tell people that, but it's the math. Over the next 30 years, so starting today, 30 years from now, I'm getting tired of hearing myself say this, but I can't seem to get my brothers and sisters around here to digest the number. We're going to borrow $114 trillion. In today's dollars, 38 trillion of that is the shortfall in Social Security. When you add up, here's our shortfall and here's our financing costs. 80 trillion and a half are the shortfall in Medicare. So about 75, 25. How many politicians do you hear, how many accountants, how many smart people you see talking on financial television say, hey, we're heading towards a debt crisis and it's healthcare costs? Oh, by the way, the rest of the federal budget actually has about $1 trillion, $1.9 trillion positive balance. And you got to understand, it's autopilot. These are earned benefits. Your society, your government, your country made a deal with you. You work this many quarters, you reach this certain age, you're part of a certain tribal group, other things, you get these benefits. Fine. You think back 20 years ago, if we had taken parts of a little sliver of Social Security and allowed the individual to put it in private accounts, the accounts would have been so much more robust. Democrats absolutely demagogued that. Oh, that's the end of the world. And now we're here 20 years later, and we're a decade away from the Social Security Trust Fund being gone. How many members here get behind these microphones are willing to tell their constituents the truth that you're heading towards about a 25 to 27% cut in Social Security unless we come up with some big, bold solution. And the problem is the constant, oh, let's just raise taxes. Except the problem is that's just the Social Security portion. The Medicare is 3/4 of all the coming debt. And the amount of taxes you have to raise, are you prepared for the amount that actually starts to slow down the economy? So there's the other board. I have not shown this one in about a year. This is actually 2020 data. The numbers are actually much worse today because the healthcare inflation, I live in a place that has about 12% inflation. We're the highest in the continental United States, the Phoenix, Scottsdale area. But base inflation, healthcare inflation has been up around 16%. So these numbers are much uglier today. And this is really uncomfortable, and this makes people upset, but it is the math. A typical couple retiring, so let's say you're retiring right now. You're going to receive $3 for every dollar you put in. It's the math. Now, on Social Security, you get what you put back in. You get a little bit of a spiff, but if you'd actually been able to put those dollars into the markets or into some other, a bond, you'd have much better. But on Social Security, you basically get back what you put in. Okay? Problem is, for that couple, on Medicare taxes, you will have paid about $161,000 in taxes, and you're going to get about $522,000 in benefits. It is this gap right here that bankrupts your country. It's healthcare costs. It's the math. And I know it upsets people.